Hi everyone, welcome back to my channel. Don't forget to subscribe my channel and press the bell icon. This video is about normal walking gait. Let's start from definition. Normal walking gait is a series of rhythmical alternating movement of the trunk and limb, which result in the forward progression of the center of gravity. Center of gravity. In anatomical position, the center of gravity lies approximately anterior to the second sacral vertebra. However, since human beings do not remain fixed in the anatomical position, the location of the center of gravity changes constantly with every new position of the body and limbs. There are four major criteria that are essential for walking. First one is equilibrium, means state of physical balance. Equilibrium is the ability to assume an upright posture and maintain balance. Second one is locomotion, the ability to initiate and maintain rhythmic stepping. When we started movement from one place to another. Third one is musculoskeletal integrity, include normal bone, joint and muscle function that provides support, stability and movement to the body. Last one is neurological control. To create voluntary movement, the central nervous system processes sensory information supplied by the eyes, ears and other sense organs and receptor of the body. It then selects the appropriate response, plans and then carries out the movement by sending nerve impulses through the motor branch of the peripheral nervous system. Gait cycle is subdivided into stance phase and swing phase. Stance phase is the period of time when the foot is in contact with the floor. The stance phase can be further subdivided into 5 stages. This phase begins with the initial contact of the heel on the ground, then foot flat. After foot flat, mid-stance begins. Mid-stance is the first half of single limb sport. Weight is aligned fully over the sporting foot through the ankle dorsiflexion, while the hip and knee extend, as the other foot lifts off the floor, then heel off, and finally toe off. The aim of this phase is shock absorption, weight-bearing stability, and reservation of progression. Swing phase. During swing phase, the foot is in the air. This phase begins with the initial swing. After acceleration, swinging limb overtakes the limb in stance. And lastly, swing phase terminates. Time frame. 60% time is spent in stance phase and 40% time spent in swing phase. With increasing walking speed, stance phase decrease, swing phase increase, while double sport also decrease. Stance phase. First image shows the heel strike. In second image, you can see foot flat. Third image shows mid stance. In second last image, you see heel off. And then lastly, toe off. Swing phase. First image shows initial swing begin. In second image, swinging limb overtakes the limb in stance. And in third image, swing phase terminate. Joint movement. During initial contact, when heels strike, 25 to 30 degree flexion occur at hip joint and 0 to 5 degree extension at knee joint, and 10 degree dorsiflexion occur at ankle joint. Loading response space. Heel strike to foot flat. 15-degree flexion at knee joint and 10-degree plantar flexion at ankle joint. Mid stance. Foot flat to mid stance. 25-degree hip extend and 15-degree knee extend. 10-degree plantar flexion and 5-degree dorsiflexion at ankle joint. Terminal stance. Mid stance to heel off. 0 to 20 degree hip extend and 5 to 10 degree dorsiflexion at ankle joint. Pre-swing. When heel off to toe off. 20 degree extension and 0 degree flexion at hip joint. 0 to 40 degree flexion at knee joint. 10 degree dorsiflexion and 20 degree plantar flexion at ankle joint. Initial swing, toe off to early. 15 degree flexion at hip joint, knee flex 60 degree. 10 degree plantar flexion at ankle joint. Mid swing, 25 degree flexion occurs at both hip and knee joint. Terminal swing. Hip flex 25 degree and 0 to 5 degree knee extend. Different muscles work during walking, and these are hip flexors, include iliopsoas, tensor fasciae lata, sartorius, rectus femoris, and adductors. Brief activity at beginning of swing to initiate hip flexion. These are silent at mid-swing. Eccentric control of hip extension at terminal stance. Next, gluteus maximus. Function with hamstring to reduce forward trunk. Next, we see how other muscles work during walking. Hip adductors stabilize the limb at heel strike and stabilize the limb during external rotation. Hip abductors stabilize pelvis and control lateral pelvic drop. Quadriceps extend knee to place foot just prior to initial contact. Also absorb shock and provide knee stability. Hamstring active from end of swing phase through loading response. It prevents hip flexion at beginning of stance. It also assists with knee flexion during swing. Tensor fasciae lata. Active at terminal swing with gluteus to stabilize iliotibial band. Active at end of stance and beginning of swing to assist hip flexion. Pre-tibial muscles include tibialis anterior, active from initial contact through loading. Response to reduce ankle plantar flexion. It active from pre-swing through swing to clear toes from floor. Gastrocnemius soleus, active just after mid-stance through terminal stance to reduce forward progression of the tibia. It stabilizes knee at terminal stance to pull femur posteriorly to extend knee. Frontal kinematics. In early stance, E version unlock the mid-tarsal joint. It allows shock absorption. In late stance, inversion lock the mid-tarsal joint, allowing arched forefoot lever for heel off. Gait analysis. Forces which have the most significant influence are due to gravity, muscular contraction, inertia, and flow reaction. In this image, you can see the force that the foot exerts on the floor due to gravity and inertia is opposed by the ground direction force. Ground direction force may be resolved in horizontal or vertical components. Understanding joint position and reaction force lead to understanding of muscle activity during gait. Next we discuss control mechanism of gait. Let's start from spinal cord. It generates pattern, reflex action and execute other rhythmic movement. Brainstem and cerebellum. It improves coordination of activation pattern, weight spot. Basal ganglion. It provides dynamic stability, initiate movement and also terminate movement. Cortex. Adaptable motor control system to meet goals in different types of environment. Essential requirements for successful locomotion include progression, stability, and adaptation. During progression, coordinated and rhythmic pattern of muscle activation in legs and trunk. It requires the ability to initiate and terminate locomotion. Guide locomotion toward endpoints. Stability. Appropriate posture for locomotion and dynamic stability. Adaptation to avoid obstacles, navigate uneven track, and change speed and direction as needed.
Thank you for watching. Please like, share and subscribe.